My name is VBautista, and this is Grace. She'll be my patient today, and she also happens to be my mom. I'll be performing a head-to-toe assessment on her. The first thing I'm going to do is wash my hands and place my gloves. First, I'll be checking Grace's mental status. Grace, can you please tell me your first and last name?
Altagracia Matosinos.
Can you tell me where you are right now?
In Berna's house.
Perfect. And what's the date today?
April 14, 2016.
Wonderful. So Grace is alert and oriented to person, place, and time. And overall inspecting her, looking at her, I would check her hygiene and her grooming, and she is well kept. Throughout the interview, I'll be checking her speech, attention, and her memory. So the first system I will check is her vital signs. So first, I would check and measure her height and her weight. Next, I would check her temperature, her blood pressure, her heart rate, her respiration rate, and her oxygen saturation. Next, I will move on to checking her pain. Grace, are you experiencing any pain right now?
No.
Grace is not experiencing pain, but if she were, I would have her rate it from 0 to 10. 0 meaning no pain, and 10 meaning excruciating pain. Then I would have her name the location, characteristics, alleviating factors, and aggravating factors. Finally, I would document everything. So her first area that I will check is her head. So I'll be inspecting the scalp itself, checking for any redness, any lesions, any masses, checking the hair distribution. Her scalp looks fine. Moving on, I'll be palpating her frontal and maxillary sinus. So first, her frontal. Any pain, Grace?
No.
And now moving on to her maxillary sinus. Any pain?
No.
So I'm checking for any pain or tenderness. She's not experiencing any. If she were, it would be indicative of sinusitis. Next, I will be palpating her lymph nodes. First, her occipital, preauricle, postauricle, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and her supraclavicular. Her lymph nodes are not palpable, which is a normal finding. If they were palpable, it would be abnormal and it would show that she had some sort of infection or disease. Now moving on to her eyes. So Grace, if you can look straight forward at me, I'll be inspecting the eyes itself, checking the color, the skin integrity around the eyes, checking the hair distribution of the eyebrows and the eyelashes, checking for any redness, any abnormal masses, any abnormal drainage. And her eyes look fine. Next, I'll be checking for PERLA. And PERLA stands for pupils are equal and round and reactive to light accommodation. So first, I would dim the room. I would grab my pen light. Grace, if you can just look straight forward at my nose. I'll be shining the pen light in her face towards her pupils. And what I should see is that her pupils constrict. So she is positive for PERLA. Next, I'll be checking her extraocular movements by checking the 6 cardinal gazes. So if you can follow my pen here. Wonderful. So her extraocular movements are intact. Next, I'll be checking her peripheral vision and her optic cranial nerve by performing a confrontation test. And this confrontation test is called the static finger wiggle test. I'll go behind Grace here. And Grace, can you please tell me if you can look forward here, look straight ahead, if you see the fingers wiggling to your right, to your left, or both. Okay?
Okay.
Okay, here we go.
Right.
Wonderful. Keep looking straight ahead.
Left.
Great.
Middle. Both.
Both. Wonderful. So her optic nerve, her peripheral vision is intact. Moving on from her eyes, I would check her ears. Check the skin integrity of the ears, check for any redness or swelling, any abnormal drainage, and it looks fine. I will next be performing a finger rub test. If you can tell me if you hear this, okay, Grace?
Okay.
Do you hear that?
Yes.
And on this side?
Yes.
Wonderful. So her acoustic cranial nerve is intact. Next, I'll be checking for hearing loss. And the two tests to perform when checking for hearing loss is the Weber test and the Rhine test. So grabbing my tuning fork here, I will first be performing Weber test. The Weber test is checking for lateralization. First, I will engage my tuning fork. And Grace, can you tell me if you hear this in the middle, in the left, or in the right? Okay? Engage my tuning fork, place it on top of her head here. Okay, now that it's stopped vibrating, Grace, do you hear it in the middle, left, or right?
Middle.
Wonderful. The next test I will be checking is the Rhine test. And the Rhine test checks for air conduction versus bone conduction. And air conduction should be greater than or equal to bone conduction as a normal finding. So I will engage my tuning fork here. Grace, can you let me know if you hear it better or longer near your ear or on your ear? So engage my tuning fork, placing it near her ear, or maybe I'll do it on this side. When it stops vibrating, placing it on her ear, the bone of her ear. And Grace, did you hear it longer near your ear or on your ear?
Near my ear.
Wonderful. So now moving on from her ears, I will look at her nose. I will inspect the nose itself, checking the skin integrity, checking the mucous membrane, inspecting for any swelling or abnormal drainage, and her nose looks fine. I'll also be inspecting the septum to make sure it's midline and not deviated. Next, I'll be checking using my alcohol swab here. Go ahead and close your eyes. Do you smell this?
Yes.
So her olfactory cranial nerve is intact. So now moving on, let's check your mouth and your throat. So I'll be inspecting the skin itself. And if you can open your mouth for me. Wonderful. So I'll be checking the mucous membrane to make sure it's moist and pink. Check for any abnormalities such as swelling or masses, and it looks fine. Checking the teeth itself, and her teeth look fine. Using my tongue depressor here, I'm going to have her say ah. Good. And when she says ah, I should see her uvula raise up and stay midline. And I'm also checking her gag reflex. Wonderful. If you can stick out your tongue for me. Great. Can you move it side to side? Good. Oh, actually like this. Wonderful. And then if you can please, I'm going to place my hand on your cheek. If you can push against my hand with your tongue. Go ahead. Wonderful. And on this side. Great. And so your hypoglossal cranial nerve is intact as well. I'm also going to be checking if you're able to follow my commands with facial expressions. So if you can smile. Wonderful. And if you can frown. Good. Puff your cheeks. Raise your eyebrows. Clench down. Good. Can you move your mouth side to side? Perfect. And I'm checking her TMJ here. So her mouth and her throat look intact. It doesn't look like there's any deficiencies there. Moving on to her neck, I'll be inspecting the skin of her neck, checking for any redness, any swelling. Also been looking at the trachea here, making sure it's midline. Great. Next, I'll be moving on to her thyroid. So I'll go behind her here, and I will go ahead and extend your neck up and swallow. So a normal finding for her should be that her thyroid is not palpable, and there should not be any masses or nodules or goiters. And her thyroid is fine, it's normal. Next, I'm going to have her shrug her shoulders. Can you shrug your shoulders for me, Grace? Wonderful. So when she's shrugging her shoulders here, it shows that her trapezius muscle and her sternocleidomastoid muscles are intact, and also that her spinal accessory cranial nerve is functioning. Next, moving on, I'll be checking her musculoskeletal system. So I will first be inspecting all of her joints here. Wonderful. Checking the limb discrepancies, any masses, any abnormalities. Inspecting the joints, they look fine. Oh, sleepy. Okay, so next I'll be checking for active range of motion. So please follow my commands here, Grace. Can you move your mouth side to side? Can you shrug your shoulders? Can you rotate your head? Checking your neck here. Checking your elbows and your wrists. If you can rotate your wrists, wiggle your fingers. Rotate your back. If you can rotate your ankles around and wiggle your toes. Wonderful. And then if you don't mind standing up, let's check your knees. Make sure you can lift your knees up like this. Wonderful. Oh, so sorry. Yeah, are you okay there?
Yes.
Wonderful. Go ahead and sit down, and I'll be checking range of motion against resistance. And the range of motion against resistance is graded from 0 to 5+. So I'm going to push against certain areas here. If you can just push back against me here. First your neck. Push. Wonderful. Neck. Let's try your shoulders. Push against my hands. Oh, very good. And push against my hands again with your hands. Oh, wonderful. Let's try your feet. Very good and very strong. So I would rate Grace as 5+. Next, I'll be moving on to your gait and stance. So can you please walk for me? Wonderful. Take your time. Go ahead and walk back. Take your time. Wonderful. So go ahead and just stand here. I was checking her gait and stance, in particular checking for any Parkinsonian gait or ataxic gait. If you can please touch your toes. I'll be checking her vertebral column. The curve of her spine is normal here. Checking for any scoliosis, kyphosis, and lordosis. Wonderful. And there's no issues with that. Let's go ahead and have you lay down here. Great. And let me have you, I'm going to perform straight leg raises. So, any pain?
No.
Okay, wonderful. So I'm checking for any herniated disc. She doesn't have that. So let's have you stand up. Are you okay?
Yes.
Okay. So skeletal. Next, I'll be moving on to her neuro. So go ahead and sit down. I'll be checking your neurological system, Grace. So using a pin here, it's dull and sharp, okay? Can you see that?